I'm glad to be here tonight, and I wanted to start with my appreciation to Dr. Roth and say that I appreciate, especially as she did tonight, she brings to the forefront of our mind the history and how we can do what we do now because of those that came before us. Initially, when I was asked to speak of the topics that most of them have already introduced you to, I thought of my own history and my own mission, and I'm glad that she brings to my memory that it's not just my mission, but there are others that have contributed to me, and that my contribution will contribute to others as well. She's a great example in showing that this work is a large work, and that even though we're an individual person, we have a very important part of that. One thing that I also appreciate about Dr. Roth is that as I told her about my new role, I was a little bit hesitant because I feel like sometimes people may interpret it as though I have gone to the dark side. But as I explained to her what my role is in my new position, there was a gleam in her eye, and she was very encouraging to me. And then also, I understood from her that I have another side. That's maybe my dark side, but I also have the light side of my nursing background where I focus on healing touch. So I have two sides of myself that are in nice balance. So as I tell you a little bit about my dark side, I also want to shed a little light on it. So currently I am a director of professional education in a startup company that was founded at the Purdue Technology Incubator. So a chemist had developed a molecule that actually is helpful in intraoperative imaging, and it is sensitive to specific types of non-small cancer cells, so that when physicians go, mostly thoracic surgeons, and they go in to remove the tumors, they use special cameras that actually light up the tumor so that they can more effectively remove the tumors, and then also find additional synchronous lesions that are not necessarily that other imaging had found. So this improves the outcomes of these patients, and that was the main purpose. That when this opportunity came up for me, I took it because I felt like this is an improvement of not only patient outcomes, but then I also got to do, as Ricky said, tell surgeons what to do. So my job is to take all the knowledge of this new molecule and the cameras that we use and instruct these surgeons on how to use this new technology. So rubbing shoulders with some nationally known surgeons has been very interesting. I've only been doing this for about 4 months, so I feel like I'm drinking from a fire hose at the moment. But learning the chemistry of everything, working wet bench research, the aspect of clinical research and all of the FDA things that we have to do to comply with all of the policies that they have put forth. And then also the sales aspect of things and the commercialization of the product once we finish our clinical trials. So I feel, and also the development of the cameras, because the cameras didn't really exist for this specific purpose, so I'm helping engineers develop the specific type of camera that would work effectively. So I'm kind of treating this as a postdoctoral experience of my own design. And hopefully, as these gentlemen have said, you never really know what your trajectory is going to be as a PhD. You kind of make it up as you go along, and it's very interesting to me how opportunities present themselves. Because I had moved to a whole new environment, to a new city, to a new state where I didn't have any connections necessarily, but this job just happened to pop up, and my PhD is what actually got me the job. So because as others have spoken, it helps to bring my education, my knowledge up to a level where physicians can actually feel like they can talk to me, and where PhD chemists can feel like they can speak and I can get a minute part of it, but act like I know what I'm talking about. So I really appreciate not only having the understanding of where the background of nursing and the personal touch that it brings to our patients' lives, that now I'm learning more about other aspects of the ever-changing landscape and of Medicare, of medical care, and being able to keep up with the times. Because with so many other, with so many other jobs, there's things that are coming out that didn't even exist when I began nursing school. So I am very appreciative of the opportunities that have been given to me and trying to make the most of everything that comes my way. And I thank you all for helping me build what I am today, and I appreciate it. And I say these things.